So today we are going to discuss regarding the anal canal, which forms the terminal part of large intestine. Regarding the situation of anal canal, this anal canal pierces the pelvic diaphragm. This pelvic diaphragm forms the floor of the pelvis. So it pierces the pelvic diaphragm here. So here it pierces the pelvic diaphragm and it passes. So this is the exactly anal canal. And here we can say this anal canal in the anal triangle of perineum, and in both sides we are having the ischio-anal fossa, and this forms the ischio-anal fossa, and this fossa will help in the expansion of anus during the passage of flatus. And here there will be no saculations like hastrations, which we had seen as the feature of large intestine, that won't be present here, and tinea also absent here. Tinea is nothing but the three ribbon-like structures which helps in the formation of hastration. Those things were absent. So first point regarding the pelvic diaphragm, second thing regarding the ischio-anal fossa, and third point regarding the sacculation and tinea, which were absent. So let's see regarding the length of anal canal, it is 3.8 centimeter. So this is 3.8 centimeter and it extends, actually this is the rectal part, and we know this is the perineal flexure of rectum. In last video we had seen. If you have any doubt, just check out the link. And here it extends from the anorectal junction to the anus. So the opening is called anus. And then this anal canal is surrounded by inner involuntary sphincter. So this blue color, this one is the internal sphincter, anal sphincter, and this green one is external anal sphincter. I will show you in this image also, this cross sectional view. This blue one, which is exactly surrounding, this one is internal, and this green one, which is present outside this, outside is external anal sphincter. So the main thing regarding this, both the anal sphincters, where this internal one is involuntary and made of smooth muscle, and this external anal sphincter is voluntary and it is made of skeletal muscle. We will see in detail regarding these anal sphincters later. And because of these anal sphincters present at the end of the anal canal, it makes the lumen closed, and the lumen will appear like anteroposterior slit. So now let us discuss regarding the anorectal junction. So in previous video we had seen regarding the rectum in detail. So we all know that the rectum extends from S3 level and it ends in the S5 level, and here in case of rectum we have two types of flexure. One is sacral flexure and the another one is perineal flexure. And this, after this perineal flexure, this convexity, there arises our anorectal junction. This is the exact location where our anorectal junction is located, and it is 2.3 centimeter in front and slightly behind the coccyx. And here this ampulla, like this dilated part of the rectum, pierces into the pelvic diaphragm. In last image we had seen pelvic diaphragm is situated here, and this ampulla of rectum pierces the pelvic diaphragm and forms the anal canal. So this is the exact anorectal junction. And here in case of male, the location of anorectal junction exactly corresponds to the level of the apex of prostate regarding the anus. So here in case of anus, we all know this is a simple opening, and here it is situated 4 centimeter in front and below the coccyx. Like in case of coccyx, it is 4 centimeter related, and this anorectal junction is 2.3 centimeter in front of the coccyx. And in anus, we can see skin which is highly pigmented and it is thrown into radiating folds. And here in case of anal ring, we can see the apocrine glands present over. So now let us discuss regarding the relations of anal canal. So first regarding the anterior relation. So in case of anterior relation, we will be having different relations in case of both male and female. So this is regarding the male cross section and this is female cross section. So this is the rectum, you can see here, rectum starting from S3 vertebra, and here you can see the perineal flexure, here also you can see perineal flexure, and in case of both the male and female you can see perineal body in common. Perineal body you can see in female also. And in case of male, you can see the urinary bladder in front of rectum. So exactly in front of anal canal, the anterior relation would be urethra, which one is mainly membranous urethra, and bulb of penis, that you can see in case of male. And in case of female, this is the lower part of vagina, which is anteriorly related to the anal canal. And in case of posterior aspect, in both males and female, it is same only. Here we will be having the anococcygeal ligament. Here it will be there, and we can see in posterior relation the tip of coccyx. So posteriorly we have to remember regarding the two relation. One is anococcygeal ligament and second one tip of coccyx. So this is all regarding the anterior and posterior relation. In this image, you can see the pelvic diaphragm present here, and this blue one is representing the internal anal sphincter, and this green one is representing the external anal sphincter. So now in case of lateral relationship, already we had seen regarding this relationship. So here we are having the ischio-anal fossa. So that is the one which is laterally related to this anal canal, ischio-anal fossa. So this is all regarding the relationship of anal canal. So let me tell you again. So in case of anterior relationship, in case of male it is different and female it is different. In male we can see urethra and bulb of penis, and in case of female we can see the lower end of vagina. But there is one thing which is very similar in both, that is perineal body. And in case of posterior aspect we can see the anococcygeal ring, anococcygeal ligament and the tip of coccyx, that is the second part. And in case of lateral aspect we can see the ischio-anal fossa, which is related to both sides of the anal canal. So now let us discuss regarding the internal features of anal canal. This anal canal is divided into three parts. One is upper mucosal part, and second one middle part or transitional zone, pecten, and regarding the third part, lower cutaneous part. Here this upper mucous part is around 15 mm and the middle part is also 15 mm, and the lower part, that is lower cutaneous part, it is 8 mm, and also it may extend up to 10 mm. So now let's see in detail regarding the upper mucous part. So this upper mucous part is lined by mucous membrane, and which will be having the simple or stratified columnar epithelium. And this part is endodermal in origin. So here in this mucous membrane we can see 6 to 10 vertical folds of mucous membrane like this, and this is called as, first point, this is called as anal column of Margagni. And the lower end of this anal canal gets united by a transverse mucous membrane, and these are called as anal valve like this, and this is called as second part, which is also called as anal valve. So here in this anal valve there will be slight depression above like this, and these depressions were called as anal sinuses. Anal sinus. So here this anal valve together forms a transverse line that runs all around the anal canal like this, and this line is called as Pectinate Line. And this Pectinate Line forms the junction between the ectoderm and endodermal origin of tissues. So above the Pectinate Line, the tissues were arising from the endodermal origin, and below the Pectinate Line it arises from the ectodermal origin. And here in case of anal valves there will be small epithelial projections. Those were called as anal papilla. So regarding the upper mucous part, which is endodermal in origin, it is lined by simple stratified columnar epithelium, and here we will be having in mucous membrane there will be vertical folds from 6 to 10 in number, and here in the that folds were called as anal column of Morgagni, and there comes the small transverse mucous fold covering the tip of the column, that were called as anal valve, and there will be mild depression above this anal valve, that is called as anal sinus, and all this anal valve gets connected to form a line, that is Pectinate Line, and this line forms the junction between the ectodermal and endodermal origin of tissues. And here in case of anal wall, there will be occasionally some epithelial projections which were also called as anal papillae. So now let us discuss regarding the middle or transitional zone or pecten. So this middle part. So in case of middle part, it is also 15 millimeter in length as similar to the upper part. And here in case of middle transitional zone or pecten, it is lined by the mucous membrane made of stratified squamous epithelium. But in case of upper part, it is columnar epithelium. And here we will be having no sweat glands, no sebaceous gland, and hair follicles. And in case of this middle part, in the mucous membrane, we will be having dense venous plexus. So this middle part appears very bluish. And in case of the lower limit of the middle part, we will be having white line of Hilton. So in case of middle or transitional zone or pecten, it is lined by stratified squamous epithelium and there will be no sweat glands, sebaceous glands and hair follicles, and this mucous membrane will be having the dense venous plexus. So this appears very bluish. So now regarding the lowermost part, which is 8 millimeter, as we had already seen, and this lower part is also called as lower cutaneous part. As mentioned here, this is lined by the lining which is resembling the true skin, and it has its own sweat glands, sebaceous glands and hair follicles. So this is all regarding the internal features of anal canal. So now let us discuss regarding the musculatures of anal sphincter. So this one is the internal anal sphincter. Already we had read regarding the walls of GIT in some separate video. So there we had studied regarding the muscular coat. There will be two types of muscular coat in case of large intestine. One is thick circular and thin longitudinal. This thick circular coat of large intestine extends downwards as the internal anal sphincter. So this internal anal sphincter is involuntary in nature and as it is made of smooth muscle. So now regarding the external anal sphincter. So this external anal sphincter is voluntary in nature and it is made of skeletal muscles. And this external anal sphincter have three different parts. So one is subcutaneous, one is deep and another one is superficial. So this is all regarding the musculature of anal sphincter. Regarding the stimulation and nerve supply, we will be seeing later. So first one is internal anal sphincter. We all know regarding the intestinal wall musculature. So in case of intestinal wall, we will be having circular muscle fold and longitudinal muscle fold. And this internal anal sphincter arises from this circular muscle fold. You can see here it extends directly from the rectum and it extends up to the anal canal. It becomes very thick and forms the internal anal sphincter, and it is involuntary in nature because of the smooth muscle. And this external anal sphincter is voluntary in nature and it is made of skeletal muscle, and it is divided into three parts. One is superficial, then deep and subcutaneous. So now let's see regarding the conjoint longitudinal coat. Already we had seen from the circular muscular coat, our internal anal sphincter had formed, and now here there will be puborectalis muscle present over here, which combines with the longitudinal muscle coat of large intestine and forms the conjoint longitudinal coat. So it extends like this, like here there will be longitudinal coat and it combines with the puborectalis muscle and it extends down like this. And here there will be external anal sphincter, and this coat extends between both the anal sphincter, and finally it divides into a fan-shaped fibroelastic septa, and later it pierces the subcutaneous part of external anal sphincter. So puborectalis and longitudinal muscular layer of anal canal. So next regarding the anorectal ring. This is a simple muscular ring and formed by the fusion of puborectalis, upper part of external anal sphincter, and internal anal sphincter. So this is how anorectal ring had been formed. So now regarding the arterial supply of anal canal. Above the pectinate line, it is supplied by superior rectal artery, and it is a branch of inferior mesenteric artery. And below the pectinate line, it is ectodermal in origin, and above the pectinate line, it is endodermal in origin. Below the pectinate line, it is supplied by inferior rectal artery, which is a branch of internal pudendal artery. So this is all regarding the arterial supply. So now let's see regarding the venous drainage of anal canal, and the understanding of venous drainage of anal canal is very very important because we should know how the hemorrhoids is getting originated, whether it belongs to the primary category or external hemorrhoids. That will be very clear once we understand this. And first, this is the internal anal sphincter and this is the external anal sphincter. First, let us talk regarding the internal rectal venous plexus. So here internal rectal venous plexus is present over here, and external rectal venous plexus is present over here. You just imagine this, and this internal rectal venous plexus drains into superior rectal vein, which is also called as hemorrhoidal vein. So this internal rectal venous plexus gets freely communicated with the external venous plexus also, and also with the middle and the inferior rectal vein. And this internal rectal venous plexus forms the major area where the portal and systemic veins get anastomosed. And these veins are present at the anal column at 3, 7 and 11 o'clock position. So whenever there is any problem in the portal and systemic venous anastomosis, there will be dilatation of the veins leading to the primary hemorrhoid, which we can see exactly in this clock positions 3, 7 and 11 o'clock position, which is leading to the primary hemorrhoids. And this superior rectal vein finally drains into inferior mesenteric vein. So as we discussed regarding the internal rectal venous plexus, the same way external rectal venous plexus is there, which is really communicating with the internal plexus also and also with the other veins. And it exactly presents between the anal canal and the external anal sphincter, you can see. And the upper part of the anal canal drains directly into the superior rectal vein, which drains into the inferior mesenteric vein. And then regarding the middle part of the anal canal, this middle part drains into the middle rectal vein, which connects here. You can imagine like this. This is the middle rectal vein, and this middle rectal vein directly drains into the internal iliac vein. And the lower part of the anal canal drains into the inferior vein, inferior rectal vein, and this inferior rectal vein drains directly into the internal pudendal vein. First, I had talked regarding this internal venous plexus, then regarding the external venous plexus, and regarding the exact venous drainage. First one, the upper part drains into the superior rectal vein, then the second part drains into the middle rectal vein, and the third part drains into the inferior rectal vein. And now, at last, regarding the anal veins. And these anal veins were seen in the anal margin arranged radially. So, whenever there is pressure in the anus because of the feces, this anal vein may get rupture, and that leads to the swelling in the anus, leading to the formation of external piles, which is mainly called as subcutaneous perianal hematoma, which we had encountered in clinical practice mainly as external piles. This is all regarding the venous drainage of the anal canal. So pectinate line, above the pectinate line, it drains into the internal iliac nodes. And below the pectinate line, it drains into the superficial inguinal nodes. So this is all regarding the lymphatic. Now let us discuss regarding the nerve supply of anal canal. Before entering into the nerve supply of anal canal, let me give you a quick recap regarding the nervous system of our body. Our nervous system is divided into central nervous system and peripheral nervous system. We are not going in detail. I am just giving you a quick recap. So in case of peripheral nervous system, we have sensory and motor. In case of motor, we have two different types. One is somatic nervous system and another one is autonomic nervous system. And this somatic nervous system mainly acts on the skeletal muscles. And this autonomic nervous system mainly acts on the smooth muscles present over the intestines and urinary bladder and heart muscles. This autonomic nervous system is further divided into sympathetic and parasympathetic. So simple, whenever any smooth muscle is in fright or flight response, sympathetic will come and cool it down. And if there is no problem at all, then comes our parasympathetic activity, which mainly focuses on rest and digest. This is sympathetic is fright and flight one. So whenever there is any stress, sympathetic will get activated, and whenever in case of normal situations, our parasympathetic activity will be more towards the smooth muscle. So here comes our major marker, that is pectinate line. Above the pectinate line, it is endodermal origin, and below the pectinate line, it is ectodermal in origin. So above pectinate line, the sympathetic activity and parasympathetic activity both will be there, and sympathetic activity will be through L1 and L2 through the inferior hypogastric plexus. So if you have any doubt regarding the enteric nervous system, I will give the link above. You just check out that particular video. And parasympathetic activity is through S2, S3 and S4. And below the pectinate line, there will be somatic nerve supply through inferior rectal nerve at S2, S3 and S4 levels. Internal anal sphincter and external anal sphincter. Already I had told that internal anal sphincter is of smooth muscle and external anal sphincter is of skeletal muscle. This is why I had explained the whole in regarding the nervous system. So this smooth muscle is supplied by both the autonomic nervous system, that is sympathetic and parasympathetic activity, and this skeletal muscle is supplied by the somatic nervous system. So this based on this autonomic nervous system, sympathetic trunk will promote the contraction, as I had told in case of fright and flight, and parasympathetic activity, that is during the normal condition, it will relax the internal anal sphincter. So this is how the anal sphincters are getting activated with the help of our ionic nervous system. Regarding the histology part, this we had already discussed. I am just making you recollect. So the upper part of anal canal is made up of simple or stratified columnar epithelium, and this middle part is lined by stratified squamous epithelium. And the lower part, it resembles the true skin, where there will be presence of sweat and sebaceous glands along with hair follicles. So now let us have a quick recap. So anal canal forms the terminal part of the large intestine, and the situation is exactly below the pelvic diaphragm here, and it is situated between the internal anal sphincter here and external anal sphincter here. And here, in case of the lateral aspect of the anal canal, we can see the ischio-anal fossa, which helps in distension of the anal canal during the passage of flatus, and here there will be no circulations and tinea, which forms the major features of the large intestine. So it is absent in case of our anal canal. And let's see the regarding the extension. The length of the anal canal is 3.8 centimeter long, and it extends from the anorectal junction to the anus. And already I had told that it is surrounded by the internal anal sphincter, which is involuntary in nature, and external anal sphincter, which is voluntary in nature. So now let us discuss regarding the anorectal junction and also regarding the anal canal. So in case of anorectal junction, and we know this is the rectum, it arises from the S3 level, and in exactly in the perineal flexure of the rectum, our anal canal gets originated, and that forms the exact location for anorectal junction. And in case of male, it corresponds to the apex of the prostate, and this anorectal junction is exactly 2.3 centimeter in front and below the coccyx. And now regarding the anus. Anus is a surface opening situated 4 cm in front and below the coccyx, and it is surrounded by the skin, pigmented and thrown into radiating folds and rings of apocrine glands. And now regarding the relations of anal canal. In anterior aspect, in case of both male and female, only one thing is similar, that is perineal body, which you can see in the image. And in case of male, it is exactly the urethra and bulb of penis in the anterior relation, and in case of female, it is the lower end of vagina. And in case of posterior relation, it is same for both male and female, that is the anococcygeal ligament. You can see here anococcygeal ligament and the tip of coccyx. And in the lateral aspect, we can see the ischio-anal fossa, which gets distended during the passage of flatus. You can see here, this is the ischio-anal fossa. And now regarding the internal features of anal canal. And this anal canal is divided into upper mucosal part, middle transitional zone or pecten, and third part, that is lower cutaneous part. So in case of upper mucous part, it is of endodermal origin, and it is lined by simple or stratified columnar epithelium. And here it is 15 millimeter in length, and here we can see 6 to 10 vertical folds of mucous membrane, that is called as anal column of Margagni. And in the end of the anal column, we are having the transverse mucous membrane fold, that is anal valve, and above the anal valve, we will be having a slight depression, that is called as anal sinus. And this anal valve gets formed a transverse line called pectinate line, and this pectinate line forms the demarcation between the ectodermal and endodermal origin. And now in case of this anal valve, we will be having some epithelial projections, which were also called as anal papillae. Comes the middle part, which is also called as transitional zone or pecten. It is lined by stratified squamous epithelium, and there will be no sweat gland, sebaceous gland or hair follicle. And in case of mucous membrane of the middle part, we will be having dense venous plexus, so it appears blue in color. And the lower limit of the pecten is marked by white line of Hilton, you can see here. And there comes the third part of the anal canal, that is lower cutaneous part, which is 8 millimeter in length, and the lining resembles exactly like a true skin, which will be having both the sweat gland, sebaceous gland and hair follicles. Now regarding the musculature of anal sphincter, first let us talk regarding the internal anal sphincter. So internal anal sphincter arises from the circular muscle coat of the large intestine. This is the circular muscle coat and this is the longitudinal muscle coat. From there, our internal anal sphincter gets very thickened and forms, and it is an involuntary in nature and it is made of smooth muscle. Then comes the external anal sphincter, which is voluntary in nature and it is made of skeletal muscle. And here we are seeing regarding the conjoint longitudinal coat, and it is formed by the fusion of puborectalis muscle present over here along with the longitudinal muscle coat. So the longitudinal will be here and it forms the conjoint longitudinal coat, and when it enters between the external anal sphincter and internal anal sphincter, it becomes a fan-shaped fibroelastic setae, and finally it pierces the external anal sphincter and it enters into it. And now regarding the anorectal ring, it is a muscular ring and it is made by the fusion of puborectalis muscle along with the upper part of the external anal sphincter and internal anal sphincter. And regarding the arterial supply, above the pectinate line, it is superior rectal artery, which is a branch of inferior mesenteric artery, and below the pectinate line, it is inferior rectal artery, which is the branch of internal pudendal artery. So now regarding the venous drainage, so there are two different types of venous plexus. One is internal venous plexus and this one is the external venous plexus. This internal venous plexus mainly drains into the superior rectal vein, which is also called as hemorrhoidal vein, and it drains directly into the inferior mesenteric vein. The most clinical significance regarding the superior rectal vein is that it forms the site of portosystemic anastomosis and it is located in the 3, 7 and 11 o'clock position. So whenever there is any problem in the portal, whenever there is any problem like portal hypertension, that will lead to the formation of hemorrhoids that were called as primary hemorrhoids, and this primary hemorrhoids we can see exactly in this 3, 7 and 11 o'clock position, and this is one of the important MCQ also in case of examination. And now regarding the external venous plexus, and it is situated between the external anal sphincter and the musculature of the anal canal, and it also drains directly into the middle rectal vein and inferior rectal vein. And at last regarding the anal vein, which is arranged radially in the anal margin, and whenever there is excessive straining during defecation, this veins may rupture and form the subcutaneous perianal hematoma, which we had seen clinically as external piles. And in case of lymphatics, above the pectinate line, it drains into the internal iliac nodes, and below the pectinate line, it drains into the superficial inguinal nodes. And this is also important MCQs. And now regarding the nervous system, so in nervous system in general, we have central nervous system and peripheral nervous system, and in case of peripheral nervous system, we will be having sensory nervous system, which receives the information from the outside environment and it will take it to the central nervous system and processes will be done there, and from that we will be receiving the motor response. So in case of motor response, we have two different types. One is autonomic nervous system and another one is somatic nervous system, and this somatic nervous system completely supplies the skeletal muscle present in our body, and autonomic nervous system acts mainly through the smooth muscles. And in case of autonomic nervous system, we have two different types of responses. One is sympathetic response and another one is parasympathetic response. And this sympathetic response will get activated whenever there is fright and flight, that whenever there is any stress. And in case of normal condition, only parasympathetic activity will be more, that is during the rest and digestion. And now regarding the nervous system in particular, so above the pectinate line, the sympathetic activity is through L2 and L3 through the inferior hypogastric plexus, and parasympathetic activity is through S2, S3 and S4 through the pelvic nerve. And below the pectinate line, it is supplied by the somatic nerves that were arising from the inferior rectal nerve through S2, S3 and S4. So now regarding the anal sphincter, this internal anal sphincter, already we know that it is made of smooth muscle. So if it is smooth muscle, then the nerve supply would be autonomic nervous system. So in case of autonomic nervous system, we know both sympathetic and parasympathetic. So sympathetic, there will be contraction of the anal sphincter, and in case of parasympathetic, there will be relaxation of the internal anal sphincter. And now regarding the external anal sphincter, already we had read that it is made up of skeletal muscle. So we know that skeletal muscle is mainly supplied by the somatic nervous system in case of motor activity. And now regarding the histology, the upper part of the anal canal is lined by simple stratified columnar epithelium, and middle part is lined by the stratified squamous epithelium, and lower part is lined by true skin. Thank you so much. This is all regarding the anal canal. If you have any suggestion for the topics to be discussed, just comment below, and happy learning.